Hey guys, Dr. Adam Tice here. Welcome, my people, to today's office hours session where we will be talking about and sharing things that you need to know but nobody's telling you. And these are clinical pearls and insights and tips that I have gleaned being in a clinic for the last 12 years. So today's session is going to be kind of exciting, potentially controversial. So stay tuned. We're going to be talking about some really interesting stuff, and the topic that I wanted to talk about today is sorry about that, guys, it just bumped you. The topic that I want to talk about today is autoimmunity, and is it possible to reverse autoimmunity? That's a question that I'd like to kind of put out there, and then I have one real life case study, an example that I want to just use as to demonstrate something. But the question is, can autoimmune conditions be treated naturopathically? And further than that, can autoimmune conditions be reversed? That means, can you actually have immune diagnoses show up on labs at one point in time and then initiate naturopathic therapies and then test back later? And can that be reversed? Can those autoimmune markers be brought into range, into a normal range on a lab? Is that possible? Yes or no? That's what I want to talk about. The textbook says no. Medical school says no. Even naturopathic medical school says no. And certainly the rheumatologist says no. But in my experience and in real life oftentimes does not conform to what the textbook says should happen. Okay? And it certainly doesn't follow an algorithm. Real life is different. Real life is different than the textbook, and this is what we got to understand. So, I have a patient, and this particular patient will share, I want to share a couple of variations of this because I think this is super important. And this is definitely in the category of something that you need to know, even if this doesn't apply directly to you or your health situation. You may have a friend, or you may have a family member, or an acquaintance, or somebody you barely know that needs to know this. So that's the kind of thing, So I want to teach you guys and share, those of you guys that are sort of in the circle here and tuning in, just some of this stuff. Because there are things that the textbook says that are impossible, that naturopathically, clinically, in real life, they're actually possible, okay? And this is super individualized. You can't say, I couldn't make a blanket, I couldn't say this, that I could do this for every single person that walks in the clinic, or every single person that's been diagnosed with an autoimmune condition, or multiple autoimmune conditions, which I'm starting to see more and more and more. There are folks that are carrying or accumulating multiple autoimmune diagnoses, and then that certainly gets a little trickier. So we'll start out with some simple examples, and I think, again, just a little bit to kind of give the proper context here. When I'm working up a naturopathic case, a new case, I don't have a cookie cutter protocol for an autoimmune reversal protocol. Okay, it doesn't work like that. It doesn't exist. I don't have a treatment for Hashimoto's, or for lupus, or for rheumatoid arthritis, or for Sjogren's, or for polymyositis, or for polymyalgia rheumatica, or whatever diagnosis you want to put into that autoimmune category. I don't have a protocol cookie cutter for that. My protocols and my treatments are for individuals. And those individuals, even if they were carrying the same or similar diagnoses, they may get different treatments. They may have different susceptibilities and things like that. So again, just to be clear about that, this is not a cookie cutter thing. This is a highly individualized, personalized thing. And that's how I work with my people. And I think that's potentially why this is, why I'm seeing these kinds of results that are essentially, I mean, they're basically miraculous in the sense that I'm kind of used to it. I honestly expect some level of that, not every single time, for those symptoms to be reversed or ameliorated or made better. So symptoms and the laboratory findings, I want all of that stuff to shift. And in a perfect world, and in many cases, that happens. Does it happen every time? No. Sometimes symptoms get better, but autoimmune markers stay present. Okay, that's a win. If you can do that non-pharmaceutically without bringing on steroids or methotrexate or Enbrel or some of the other high-powered biologics or the other meds that they use with the autoimmune condition, they're usually pretty nasty drugs that definitely come with side effects. So again, we got to kind of keep in mind, and the people that I'm talking to, they're not looking for the pharma. I'm talking to the people that are looking for another way. And what I'm talking about today, you certainly, number one, as the disclaimer, out there, on the internet, whatever, out there on YouTube or in the internet, this is not to be mistaken or confused or interpreted as medical advice. These are simply case studies and real life examples that I want to share with you. And if you have a same or a similar situation as one of these cases that I present today, you must have me or somebody that knows how to do this guide you. This is not something you want to do by yourself, and I definitely don't recommend that you try to treat or control an autoimmune condition all by yourself. Okay, you need to consult a physician, you need to consult somebody and have them look at your individual case. Okay, so that being said, and then at the same time, I want you to be your own doctor. I want you to be empowered, and in that sense, I mean, take the information, find the people that you need, find the practitioners that you need, find the docs that you need, find the people that you need, like me or somebody like me that can do this, and make sure that they have the shared value and belief and philosophical approach to the medicine so that you can do this, okay? Of course, when we're working up a case, I'm always looking, and anybody, if you know me or you work with me, you know that I'm going to say this. What am I about to say? You got to get the digestion under control, even if that's not the presenting symptom that gets you in the door, that gets you to call the phone, that gets you to send that email to get in for that office visit and to get us to come up with a plan for you. I start everything by looking at the digestive system, okay, and identifying and removing any obstacles to cure. And again, if you know me or you've been around me or you've heard me talk, you know that I want the food intolerance and I want to identify and remove that obstacle to cure, because anytime we're talking about something with the immune system, I want to go and look and discuss and dial in the digestion, because the digestion is going to be key and is going to certainly be the key, because the digestive system, if the digestive system is impaired through inflammation or malabsorption, some leaky gut or something, even if it's an asymptomatic, like there's no digestive symptoms, the digestion can still be a little bit hindered, and potentially that absorption and assimilation is compromised. And if that happens over time, then there will be eventually an insufficiency or a deficiency of certain nutrients, vitamins, minerals, cofactors that can set up the stage for a diminished immunity, which can set up the stage for either just diminished immunity or compromised immunity, or in the individuals that are susceptible, like I'm talking about, that might be susceptible to an autoimmune condition, that can start to show up if you have, if that digestion compromisation goes too far, you get nutrient insufficiencies, then there might be mineral imbalances, so things like selenium, zinc, these things that are really important for the immune system. And then there can be communication breakdown in the immune system, and that's essentially what happens with autoimmune conditions. There's some kind of miscommunication within the body itself, and the ability to distinguish self and non-self, that gets a little hazy, and then self starts attacking non-self, and that's what autoimmunity is. Now, where does that happen? It can be the thyroid, it can be the joint spaces, it can be the hands, it can be different, it can be different parts of the body, okay? And it can be the skin, it can be muscles. That's what that's actually where we do need to work the case up if a person does present with a certain set of symptoms that might look as an autoimmune presentation. You got to do the good workup. I promote the good workup, and this is again what the specialists are usually pretty good at, is the workup side of things, labs, imaging, diagnostics. Getting a diagnosis is generally what the specialists are pretty good for, and I do rely on that to have that information myself naturopathically, because you need to know what is going on, and then you need to follow that up with, for example, inflammatory levels, systemic inflammatory levels in the body, things like C-reactive protein, and there's some other markers, some things that we would look at that will tell us what's the level of inflammation in the body. And again, depending on what the exact diagnosis is, those accompanying labs to really assess and get a baseline of where an individual is at. All that stuff is unique. And the textbook says, and the rheumatologist says, once you get this autoimmune diagnosis, it's one of those things that's forever, and this is just how it is. Here is the diagnosis, and here is this badge, this diagnosis, that will be carried forward without fail. And so therefore, that's why oftentimes people end up on medications for long periods of time, or cycling on and off different pharmaceuticals over time, because they're trying to manage this this autoimmune condition. So that's the kind of background of it. And I'd like to share just one particular case here. I'm gonna share one particular case, maybe another one, because it makes the good point too. Now, these are individual cases, so again, this is just to demonstrate something that's possible. I have number one, a female that is, she is now currently 39 years old, and historically there have been autoimmune antibodies, Hashimoto antibodies. So we look at the anti-thyroglobulin antibodies and the anti-TPO, the thyroperoxidase antibodies. And in this particular individual, these antibodies were elevated, and they've been elevated historically, and we started to watch an uptick. Oftentimes what you'll see in this is the TSH, the thyroid stimulating hormone, will start to go up, and that TSH will go up. And so that's why anytime I have a thyroid condition, certainly when I'm getting a baseline, I do like to see at minimum like a TSH, a free T4, free T3, which is the thyroid stimulating hormone, the free thyroid, the free T4 and the free T3, which are the hormones themselves. So we want to kind of look at that and look at those levels, and assess that. And then also the antibodies, and let's get a gauge on that and see, is that happening, yes or no. In this particular individual, yes, the antibodies were present, and slowly that TSH started to climb up, and it got up to 8, got up to 10. And so we adjusted some of our therapies. We did some therapies. I'm not going to go into detail about what those therapies were, because that's not the point of what I'm talking about right now. Well, like, what was the exact protocol? Because again, I don't have a Hashimoto protocol. I had a protocol for this particular woman, this individual that happened to have a Hashimoto diagnosis. And long story short, and I'm looking at these right now, that TSH came all the way back down into range, and so did the free T4. So initially the TSH was high, went up to 8, went up to 10. The free T4 and the free T3 were actually low, so that kind of tells us, yes, this person is looking like a low thyroid, a hypothyroid. And again, we want to look at that Hashimoto state to see is there some contributing factor there. And the immune antibodies were there historically. So long story short, we went through some protocols, let some time go by, and then we went back and rechecked. And now here, this set that I'm looking at, and this is from July of this year, about a month ago, these labs were rerun. The TSH is in range, free T4 is in range, free T3 is in range, and the antibodies are all in the negative. So, which is the reference range, which is where you want to be, which means an interesting thing happened there. At one point in time, this individual had antibodies and elevated TSH and diminished hormone. We implemented some therapies, let some time go by, go for retest, reevaluation, and everything comes back in range. Okay? Interesting. Interesting in the sense, again, that this defies what the textbook teaches us. But nonetheless, we can't discount it, because what really trumps the textbook is a real life story, a real life case. Like, this actually is happening in real life. And this is not the first time I've seen this. This is just one that popped up last week, and I happened to remember to keep this lab out because it's something that I wanted to talk about. And I kind of been tiptoeing around, sort of saying some of the stuff, talking about autoimmunity and different autoimmune conditions, the power of the diet and anti-inflammatory diet, and specifically the way that I use autoimmune diets and incorporating people's individualized food intolerance evaluations and things with this. It works. And again, I'm a clinician, so out there in the world of the internet or whatever, there's a lot of philosophy and things going on, and people talking about, potential and peak health and all this stuff. And again, the philosophy is nice, and to say that something may be possible or may not be possible, okay, that's good. I always like to keep the possibility for health, but at the end of the day, you can have the greatest reasoning or the greatest logic or the greatest sort of hypothesis or theory about something, but I'm interested in the application of that, and can we apply that theory and apply that in real life to a real person, that is going to go get a real blood lab and wake up every day and deal with a real human system. Can we plug our strategies and our principles and our modalities into that and get this kind of result where autoimmune markers reverse and symptoms improve? And the answer is yes. This is real life. Here what we're seeing. Okay, that's a Hashimoto case. I have another case that is I'm super excited to follow up on, and I've mentioned this case and again kind of mentioned some of the little bit about this case, but this individual is another female, and there are multiple autoimmune diagnoses that this individual is carrying. Historically been diagnosed with lupus and Sjogren's, to name two, and along with some musculoskeletal symptoms, and I think what is another musculoskeletal autoimmune diagnosis that is subclinical brewing, and it hasn't been diagnosed. But I think if we would have gone and checked at certain times, those markers would have been there. But we do have lab markers on some of those the ANA and a rheumatoid factor and a couple of these other ones. And of course, none of these single diagnoses, you can't hang your hat on any of these anyway to make a definitive diagnosis on an autoimmune condition. But between a collection of lab results that will do, you can zero in and dial in what is the autoimmune diagnosis going to be. And okay, again, that's what the rheumatologists and the specialists are really good at. We have all that lab workup and we have those positive markers. And in this particular case, what we have are dramatic physical symptoms, musculoskeletal symptoms, to the point of basically being non-functional, being barely mobile and barely able even to use the body because of such fatigue and weakness and muscle pain due to these autoimmune conditions. And what we've done dietarily with this individual is completely put all of those symptoms into remission. And on that one, we've seen some of the labs shift, and we're going to go back and do another check and see if they've completely gone into the negative range. So again, what we're looking for in the ideal outcome is someone presents with symptoms and positive autoimmune blood labs, diagnostic markers, and then we employ some therapies, naturopathic therapies, let the time go by. Non-pharmaceutical interventions, naturopathic interventions, let some time go by, and then again, we're interested in kind of two dimensions here, at least two dimensions. Number one, symptomatically making sure that the person improves, that their joint pains get better, their muscle pains get better, they're able to have their mobility and the quality of life there. And does the inflammation, the systemic inflammation in the blood go down? And do the immune markers reverse? And the answer is yes, they do, again. And we're going to be following up on that case again soon and see what's the latest mark. Are those markers going to go all the way in the negative? And I suspect that they might. Again, I've seen it happen before. I don't expect it every single time, but man, it is really great when it does. And this is a big deal. I think people need to know about this. So question is, do autoimmune markers reverse, and can you turn those processes off in the body and halt the autoimmune process from progressing and damaging the body anymore? Yes, you can. Now, in a best case scenario, which is kind of what I'm painting out, yes, they can be reversed. Yes, symptoms can be addressed and dialed down and diminished. Yes, autoimmune labs can be reversed and brought into the normal range. Best case scenario, yes, it's possible. Worst case scenario, you get the inflammation down and you get the whatever pain or symptom levels down, and you get the autoimmune process under control and manage it as much as possible. And again, if you can do that non-pharmaceutically without causing side effects and after effects and damaging the liver, kidney, with the whole list of, of the really direct effects of the pharmaceutical agents on the body, because eventually that's going to catch up and then there'll be other things going on. So can you do this non-pharmaceutically, 100% naturopathically, using therapeutic diet interventions, naturopathic interventions, homeopathic interventions? Yes, it is possible. But I will also say one thing with these cases. This is something that if this is you, that it's not like now these labs have reversed, I still want to follow up on these, and the responsible thing to do actually is still to check in and monitor and make sure that this stuff stays arranged, because depending on the person and how compliant you are with your treatments and your protocols, there's a susceptibility there for an autoimmune condition, the system to, when it, that the body is susceptible and manifesting this kind of pathology. So we need to stay vigilant and compliant in our protocols and need to stay in contact and have good naturopathic follow-up. And that's really the domain of preventative medicine and maintenance preventative medicine versus just a quick fix, see you later, where we might fix something for a short period of time, but then we're not on top of it and compliant and consistent, and we may or may not have much wiggle room with that, and we need to stay on top of things. And that's what I do with my people, is stay close, monitor things, preventative maintenance regimens, make sure stuff's not sneaking up on us, make sure that we're keeping, if you transform something like this in your labs, we would like to keep it that way. So doing the good naturopathic follow-up is key to make sure that you stay there, but it's 1000% possible, guys. So just wanted to put that out there. I think it's really interesting and really amazing. The body is really, really, really amazing in what it is capable of doing. And I just wanted to share that tidbit with you guys. Again, these are real people and real cases that I'm sharing with you. So that's the download for today. If you guys have questions or anything like that, please leave them in the comments, and forward this video to your friends or family or colleagues, coworkers, somebody you think that can benefit from this. Share it with them, because not a lot of people know how to do this. Not a lot of people are going to tell people that this is even possible. So it's possible, and the body's amazing, and we need to just keep that in mind and remember that as we move forward and take care of ourselves. So you guys have a great day. Stay tuned. Let me know questions or other topics you guys want to cover for office hours, real life, pearls from the clinic. That's it for today, guys. Adios for now. Have a wonderful day. We'll see you next time.